the live stream of this meeting via Cambridgeshire County Council's website. There is also a risk that we may run into technical problems, and I would ask for your patience if we do. Should this occur, I will declare an adjourn while the fault is addressed, and the public broadcast will be paused. If it is not possible to address these faults, then the meeting will be abandoned until such time as we can reconvene. Can I remind members and officers that all virtual meetings are being recorded, and the recording of this meeting will be published on the Cambridgeshire County Council website. I now have apologies from Councillor Peter Hudson, who will be joining us, but late. And I now need to do a roll call of those present, please. And when I've done the roll call, please, could you mute yourselves and obviously put up your hand if you wish to speak. The first person is Councillor Hickford.
Present.
Councillor Fitzgerald.
Present.
Dr. Robin.
Present.
Wendy Overwellborn.
Present.
Adrian Chapman.
Present.
Jan Thomas. No. Gary Howson. Louise Camphor, is it? Louise Mitchell. Alex Malon. No. I know Balmore.
Yes, present.
Councillor Ray Bisbee.
Present.
And me, Councillor John Holdings. I think we are quorate. I think we only had to be 4 to be quorate. I think so. We are. So I will carry on. As I said, I have. Do you wish to? Anybody wish to declare an interest?
Chair, I had my hand up on the apologies, if I could, please.
Oh, so you did, Roger. Sorry, mate. I was looking at what I was reading rather than the screen. Yes.
Thank you, Chair. It's come to my attention that Councillor Mallion is relatively indisposed at the moment, and maybe for the foreseeable future. And she is the representative for districts. So could I perhaps suggest that we get a sub for Councillor Mallion or a replacement, because it's vitally important that districts get the messages and what we're discussing here relayed back to them.
Yeah, thank you for that, Roger. I think we criticised her last time because she hadn't been to a meeting. Well, if she's not able to, then you know, it's not a criticism, but we do need to replace her, don't we? Can you deal with that, please, Nick?
Yes, we'll look into that, Chair. Yeah.
Okay. So anybody wanting to declare an interest? Oh, Peter Hudson.
Just to say I'm here now, John. Thank you.
Okay. Yeah. Okay.
Reference Roger's last comment. We did discuss it in some length last meeting, and it's a bit disappointing to find nothing's happened since the last meeting, because, you know, unbelievably, this is rather important.
Yes, I'll share some of that. Liz, you've got your hand up.
Yes, just to say that I have been in communication with the Chief Executive of South Cambridgeshire District Council about this issue, and I'm just waiting to hear back from her after she has spoken with the councillor concerned. So I will have that information to you very shortly, and because that was an action for me from the last meeting, and we will be able to review the situation and move forward with getting the appropriate representation.
Okay, because it doesn't necessarily have to come from South Cambs, does it? Because she's a representative of the districts, isn't she?
Absolutely, yes. I'm just waiting to hear back from the Chief Executive after she speaks with the councillor concerned to absolutely clarify the situation.
Okay.
And then
thank you, Liz.
I'll get back to the group.
Okay. I did ask whether there was any declarations of disclosable interest. Was there anybody? Nothing recorded on my screen. Okay, fine. So I now need to know if you wish to approve the notes of the previous meeting on the 11th of September. Are they a correct record? I will propose them from the chair. Is there a seconder? Thank you, Roger. Anybody objecting? Can't see anybody, so they're approved. Thank you very much. Okay, I think I've handled all the rest. Please now mute yourselves. I think you all are. And obviously press up your blue hand when you're doing it. So on the basis that the recommendation has been approved and the note is carried, an action log has been included in the published papers for this meeting, and our officers are able to inform the board whether there have been any changes made to the action log since the publication. Councillor Robin, you've got any alterations? Not councillor, I'm calling you a councillor now.
Just the item that I spoke about before, I have emailed the Chief Executive of South Cambridgeshire District Council regarding the district member representation. The other actions were for Councillor Bisbee and for Dean Birchall. I don't know if they have any updates.
Councillor Bisbee, have you got any updates?
Yes, I can inform you that I have spoken with the Chief Constable, who reiterated that the constabulary's approach to this as being the 4 E's, i.e. engagement, explanation and encouragement, with respect to all persons found breaching the legal background of COVID-19 restrictions, with recourse to enforcement as a final measure where necessary and proportionate.
Thank you, Ray. Adrian?
Thank you, Chairman. Just to add to the commentary there from Ray, as we heard on Friday, the Constabulary have also very much proactively supported the launch of Peterborough's operation, which is effective from today, and have committed to 4 hours a day on average police presence in central Peterborough, a model which I'm hoping will be seen by the public and by businesses and other visitors as a really positive step forward to complement the other E's that Ray has described. So some really positive progress, I think, since the last meeting.
Thank you, Adrian. Roger?
Yeah, thank you, Chair. I'd just like to come back on the other E of enforcement, because I do think it's important that at the end of it, after the softly approach that Councillor Bisbee was talking about last time, there's actually some teeth. So could I ask Councillor Bisbee about enforcement and how many times the police have got to that particular E and penalty notices? I understand what's happening today in Peterborough, which is obviously a good sign. But before then, and even now in other areas, exactly how much enforcement there's been?
I don't know whether there's anybody online can answer that, is there?
I think as far as enforcement, when you go to enforcement, you've got to make sure that you have the evidence in case that enforcement fixed penalty notice is goes to court. If people decide to go against that and want to challenge it. So the 4 E's allows that evidence to be there. So if you haven't engaged and you haven't explained and encouraged people and gave them the chance to go, then when you go to court, that will be challenged as to why you haven't done that. So that will be the way forward. And actually, where enforcement is required, it will be enforced. But its prevention and the spread of coronavirus remains a shared effort. Each of us has a personal responsibility to limiting the outbreak by following the simple rules around gatherings. While most people in Cambridgeshire and Peterborough have adhered to the government guidance and have been supportive of the approach being used by the police, I want to reassure people that where there has been breaches of the rules on gatherings, officers will apply the same approach as they have done throughout this crisis. That is to engage, explain and encourage. And that's to ensure that people follow the new regulations before using enforcement as a final tactic. This is a national approach, and it's done through the NPCC, which is the National Police Chiefs Council, and also through the College of Policing and a government recommendation. So that is all being followed. So demands on policing, as you may know, are now back to pre-COVID levels, making it even more important that everybody takes personal responsibility. So policing involvement is a last resort. Given the constant change in legislation, I'd like to thank the public for their ongoing support and urge everyone with information about breaches of the guidance to contact the constabulary. And I can read this out, but we can get it sent out. It is https://www.cams.police.uk/report/report with a capital R -A-breach -of -COVID in capitals -19 -restrictions. We can get that to everybody, and it is actually on the police website. So if anybody does have any breaches they wish to report, please do use that method. Thank you.
I see Roger's got his hand up again, but you didn't answer the question that he asked. How many have you nicked? Was that it, Roger?
That was exactly my question is, could I actually have an answer to my question?
Sorry?
He said he's had an answer.
No, I didn't. I said, could I have an answer to my question?
Oh, good, yeah, yes. How many have you nicked was the question.
I believe at the official count, the last one that I saw was 130. We are in a position where we're not at the bottom, we're not at the top of the national numbers, we're in the middle somewhere. So we are not out of what people would expect.
Are you happy with that, Roger?
I could go into more detail and ask for geographic and etc., but I don't think we've got time for that at the moment, Chair. I'll take it offline.
Yeah, it might be an idea if we have that as an action for next time, so that we've got that.
Thank you, Chair. That would be useful. Thank you.
Yeah. Okay. I haven't got anybody, other members wishing to raise anything on this section. So the members happy that I move on? Okay, so I'm going to go to 4. There are no public questions, and I don't think there is any. Nick, is there?
No, there are no public questions, Chair. Thank you.
Okay, so now can I invite Liz Robin, the Director of Public Health, to provide the board with a presentation on this item, please. Over to you.
Thank you, Councillor Holditch. And Nick, please could you put up the slides for the Health Protection Board update? Okay, so this is an update from the Health Protection Officer Board, which we provide routinely at this meeting. Next slide, please. Okay, so positive COVID-19 cases and numbers of hospital admissions are increasing across the United Kingdom, as you can see. So the graph on the left shows you the national 7-day average of COVID-19 cases that tested positive. It is a bit misleading because it looks as if there's more cases testing positive now than were testing positive back at the peak in March and April. But that's because not many people were tested in March and April. It was only clinical cases, mainly hospital cases. So in reality, back at that time, there may have been up to 100,000 cases that were positive. But we can see there's a very steep rise nationally in COVID-19 cases. And then on the second graph, we can see that the number of hospital admissions is starting to gradually climb as well. So people more affected by COVID-19. Next slide, please. So the next slide shows the percentage of people who are tested, who test positive, because there's always the question, as you increase the numbers of people who are tested nationally, does that mean that you get more cases? What this slide shows very clearly is that for people from the community being tested, about 7% are now testing positive. So that is a big increase on where we were 4 weeks ago. And there is a genuine increase in COVID-19 cases nationally, which is quite steep. Next slide, please. So when you look at the age groups that are showing the highest rates of COVID-19, and again, this has been shared nationally, the 20 to 29-year-old group, which is the turquoise line on this graph, you can see that as the weeks progress, it's that line that has really kicked upwards and has a very high rate of cases now of about 90 per 100,000 population. The next highest rate is in the 10 to 19 age group, and that is particularly amongst 17 years and over. So it is that young adult age group that's really showing the uptick in cases. Then next comes 30 to 39-year-olds and then 40 to 49-year-olds, so very much the working age. When you look at 0 to 4-year-olds and 5 to 9-year-olds, those figures are much, much lower in terms of cases per 100,000. So a lot of them are getting tested because of return to school, but actually the case rates are much lower in that age group. That's the national pattern, but it is reflected locally. Next slide, please. So this slide again shows where Cambridgeshire and Peterborough are on our rates of COVID-19 cases against the national picture. And what you can see on the map is high rates of cases in the north, particularly the northwest. It's increasingly the northeast as well, and low rates of cases in the south of the country. If you look at Cambridgeshire, you can see the rate of cases quite low. This is cases for the sort of the month, so for some time before now. But Peterborough cases are higher, more similar to Northamptonshire and the wider Leicestershire, although not Leicester City, where there has been a very high rate of cases. Next slide, please. And just to reflect that national map, this slide looks at the confirmed COVID-19 case rates per 100,000 population for the different regions of England. The sort of browny yellow line, which shows a very steep increase in the last 4 weeks, is the northwest region. The grey line, which also shows a very steep increase in the last 2 weeks, is the northeast. And we then have Yorkshire and Humber and West Midlands also showing quite high rates of increase. If you look for the east of England, that's the sort of purpley red line, and you can see that the rate of increase of cases in the east of England has been at a much lower rate than those northern regions, but it still is increasing gradually. So we are part of the overall increase in COVID-19 cases. Next slide, please. Getting local. What we now have is what we call our SPC charts of cases in Cambridgeshire and in Peterborough. And these charts go up to the 27th of September. So a few days ago, about a week ago. And what was happening up until then was that we could see on the left that detected cases were increasing in Cambridgeshire with this gradual climb in case numbers. So a definite increase showing there. In Peterborough, the cases up to that date were stable, although we do have some caution about that because the mobile testing unit in central Peterborough closed to walk-ins back around the 11th of September. So we think we lost some cases because of that. Some local residents are not walking in. So that may be artificially lower and may have helped with that stability. We may have seen some rise without that. After the 27th of September, and I've been looking at the latest figures, and it's a little while before they're published because we need to wait to make sure that all the cases have come in and that the figures are accurate. But I can say that in both Cambridgeshire and Peterborough, we are seeing increases since the 27th of September. So in both areas, we are seeing that upturn in COVID-19 cases, which is not as dramatic or as fast as the rises in the north of the country, but we are seeing that increase. So there is risk. COVID-19 is circulating, our rates are rising, and we absolutely need to take action across our communities to contain that rise and prevent it spreading further. So people do need to be alert, and people do need to do those basic things to stop the spread. Can't emphasize that enough. And you will see that increase coming out next week as the figures are published. Moving on, next slide, please. The thing that this map shows of Cambridgeshire and Peterborough is also what we're seeing in the most recent data, although this does cover really the month of September. And that shows that the cases are spreading more in our rural areas. So back in July and August, we were mainly seeing cases in Peterborough and then rising in Cambridge. So in our more dense urban areas. What we're seeing now is more of an increase in our rural areas as well. So the rural area around Peterborough, but also in Huntingdonshire, South Cambridgeshire, and to some extent in East Cambridgeshire and Fenland, we're starting to see that more general increase. And that map shows a more dispersed pattern. Next slide, please. Looking at our deaths from COVID-19, fortunately, those remain at a low level. So the graph shows our deaths right from the beginning of the COVID-19 pandemic. And you can see that rise back in April, May. And you can see that the death rates have fallen and currently remain low. So that is positive. But clearly, incidents, higher numbers of cases moves through to higher hospitalizations, which then moves through to higher death rates, depending on whether the people who are most vulnerable to COVID are the cases, whether they are catching the infection. So those things do tend to play out a bit over time, and we need to keep this very closely monitored. Moving on to the next slide, please. I'll move away from the epidemiology and the overall pattern that we're seeing in our rates to what we're doing. One thing that's important to note in our governance, and this has been highlighted to all of you previously, but not at this meeting, is that Peterborough City Council was removed from the national watch list as an area of concern under the Contain framework. And that was on Friday, September the 25th. We've been absolutely clear in all our communications that Peterborough was removed from the watch list because the national rates were going up and Peterborough was moving down the national rankings, not because there was no longer cause for concern. And we absolutely need to stay on the case in terms of working with our communities to prevent spread of COVID-19. Otherwise, the governance arrangements remain the same as the last meeting, so just there as a reminder. Next slide, please. So what have we done in the past month since the last meeting? Just giving you the key high points. We've continued with our daily rhythm of surveillance cell outbreak management team and the various outbreak cells, making sure we respond quickly to any outbreak which happens. What we have done through the Programme Delivery Board, which sits under the Health Protection Board, is to review the capacity requirements and skill mix around the officers and the cells doing that work. And those are multi-agency cells, to make sure that those teams and cells can cope with the increasing workload that we're expecting in autumn and winter. So that capacity review is going on at the moment. In terms of local incident management teams, the Peterborough Incident Management Team continues to meet weekly to keep a very close eye on the epidemiology in Peterborough and ensure that actions and epidemiology are fed through to the Peterborough Rapid Response Team meetings. And the Rapid Response Team works closely with communities to take the right actions. We have a Cambridge City Incident Management Team running every 2 weeks to maintain an overview of trends and cases, and in particular, keep a close eye on the return of students in large numbers, which Cambridge University came back this weekend. And we have convened a meeting in Huntingdonshire as well due to increased rates there. All these incident management teams have input from Public Health England as well as from the local authority, the district or city council, and other relevant stakeholders. So they bring everyone together around an area. Next slide, please. Universities have been an area of very strong focus over the past month. So we work very closely with both Anglia Ruskin University, which is in Cambridge and Peterborough, and with Cambridge University. There's lots of joint work. They have outbreak plans, which need to be sent up nationally to the Department for Education. And I have reviewed those plans and I have personally signed them off along with my team. There's ongoing close communication and joint work with both universities that involves ourselves, the communications team and Warn and Inform Group, Cambridge City Council and Public Health England. On schools, there has been a significant increase in the workload from schools. So John Lewis's Education Directorate and Public Health are working very closely on this through the Education Cell. And a new Department for Education helpline has also been introduced because of the volume of work. We held a briefing for head teachers with a question and answer session, which both John Lewis and myself provided updates. And that had very good attendance with over 250 participants and some excellent questions, which we also answered in writing. And we received positive feedback on that meeting. So I'm sure we'll do it again, communicating with the head teachers. Next slide, please. So care homes, lots of work going on with ongoing implementation of the care home support plan and renewed training on infection control and PPE use for all care homes. In workplaces, again, that work continues, lots of work going on to link with workplaces and both to prevent outbreaks and to manage cases or outbreaks. And we're continuing to work on our cross-border links. For events and openings, we've done a lot of work across public health, environmental health, and the district and city level safety advisory groups on how we work together to review forthcoming events. And we're increasingly going to be communicating with event organisers to make sure that they're aware of good practice in organising COVID-19 safe events, and that larger events need to be considered by the safety advisory groups. So there will be more communications going out. Next slide, please. We have another agenda item on the Peterborough Leaders Summit that was held on Friday, and that really recognised the excellent work being done through rapid response by our local communities and services. But it also asked what actions we needed to take going forward in order to re-energise that planning, and more of an update will be provided on that. And I think we've already referred to the joint strategy agreed by Peterborough City Council and the Constabulary around engaging, explaining, encouraging and enforcing the legislation in central Peterborough. Local enhanced contact tracing continues to go well in Peterborough with this very high success rate and around 90% of cases handed on by National Test and Trace being successfully contacted locally. Next slide, please. Testing has been a challenge. This was starting when we had our last meeting, but an ongoing challenge with the national testing capacity, challenges to that impacting locally, and that particularly related to higher numbers of children using the testing system with returns to school. We have been successful in reacting locally. So we've set up, working very closely with the CCG and the hospital labs, a local system for testing essential key workers, including school staff, so that can be done locally. And that makes sure that our schools keep open and that our absolutely key public services can keep running. So lots of thanks to the CCG for that. And we've also been successful in bidding for a local testing centre to open in central Peterborough. This should open in mid-October. It will be funded nationally, but it will enable walk-ins to return again. At the moment, mobile testing units don't accept walk-ins because of the testing capacity issues, but this will enable people in central Peterborough to walk in again, which we think is needed for the local population. Planning for a winter surge. This was reviewed by the Health Protection Board at a meeting, the last meeting but one. The board carefully went through what our priorities for winter are and identified the key priorities for forward planning, including a focus on capacity and business continuity, particularly the need to maintain our communication with communities and ensuring that our communities were prepared at local level and through our district colleagues. Access to testing was another priority, and promoting flu vaccination for the eligible groups. And that work will be used to inform the priorities of the Health Protection Board and Programme Delivery Board going forward. So thank you for your time and happy to take questions.
Thank you. That was very comprehensive. Well, members are thinking about questions. Could I ask you something? The recorded figures last week, which weren't correct, have they affected our figures at all? And also, you talk about universities in Anglia Ruskin, but have you gone to the University Centre Peterborough, which is run by Peterborough Regional College? And has this spike had anything to do with holidays? Because I've been to 1 or 2 coastal resorts and you couldn't move in them. That'll keep you busy for a minute or two. Yeah.
Okay, so starting with the some positive cases not being reported into the national figures.
Yeah.
We don't have a lot of detail on that yet, Councillor Holditch, so I couldn't say to you that this many figures from Cambridgeshire and Peterborough were affected on these days. We haven't had that detail, but I have looked at the numbers of cases reported through to us through the internal routes. We get an internal daily report, which isn't public yet, because those figures have to be checked and updated. And looking at that, there has likely been some impact because we had a lot of figures come through to us on Sunday, a lot of positive cases. So I think Cambridgeshire and Peterborough has been impacted, but I can't give you the exact detail on that yet because we haven't received the detailed figures. So that's the first one. The second one on the universities, when we spoke to Anglia Ruskin, we made sure that the Anglia Ruskin links into Peterborough were considered as well as the Cambridge Anglia Ruskin. So that was covered across. We're also linking through John Lewis with all the further education settings, such as Regional College, City College and so on.
No, Liz, that doesn't answer the question, I'm afraid. Then Anglia Ruskin have a separate university here which does nurses and that sort of thing, but the university centre is run by Peterborough Regional College. Although the exams are certified by Anglia Ruskin, they don't have anything to do with running it.
Okay, so I'm fairly sure that we have, because we're covering both further education, which would cover regional college, and we're covering universities, but I will contact my people who link with the universities and I'll get back to you on that question, Councillor Holditch, to make sure that that's been covered fully. I haven't got the detail with me.
Thank you. Holidays.
Holidays, I think what I would say there is that for that 18 to 30 age group where we have seen the big spike in cases, I think there is a recognition that some of the spike in that age group may have been due to people going on holiday together, particularly perhaps to other countries where the social distancing measures are not as perhaps enforced as they are in this country, because obviously there was a period when people were going on foreign holidays. So I think there is likely to be a link to holidays there for that age group. And that's the link that I'm aware of, rather than specifically the coastal resorts in the UK.
Okay. Roger?
Thank you, Chair. Could I ask for you, Chair, to Liz, just to expand on the measures that are being taken with the universities and obviously in partnership and cooperation. Just obviously we've seen the younger age group spike nationally, and I feel there's concern, particularly within universities, and we've seen it elsewhere. Some certain universities have to close down sections, etc. So if you could expand on what we're trying to do at the moment to make sure we don't get in the same situation in Cambridge and Peterborough.
Okay, thank you, Councillor Hickford. And I can certainly send around a briefing in more detail on this, because we have prepared a briefing on universities for a number of interested parties. So we have been working with the universities for some time, and firstly, it's absolutely key to communicate with students, because it's the students' behaviour that will have a major impact, both their behaviour inside the university when they're attending classes, but also their behaviour outside when they're socialising and in their free time. So we've worked with the universities on communications that will go out to all students, and on a wider communication campaign for 18 to 30s, which Christine Birchall and others have been closely involved with university comms on. So communication with students is key. We've also worked with the universities on their safety processes, the way that they will organise lectures, the way that students will stay safe on university premises and during their studying day. So there are a large number of procedures in place, and a large numbers of risk, which are based on risk assessments which have been done. So we're assured that the university has safe processes in place for education. We have detailed plans of what to do in the event of an outbreak, and we have ensured that all cases amongst university staff or students, the local authority will be informed directly by the university. So we will be kept absolutely up to date with what's going on, so that we can support the universities in terms of their outbreak management plans and make sure that they are also linked into Public Health England support. Certainly for Cambridge University, which has just returned, they are running a weekly gold meeting, and we have Public Health England and or local authority public health attendance at that weekly meeting, and similarly at regular Anglia Ruskin meetings. So we are very much staying on top of this and keeping in very close contact. Cambridge University is also carrying out weekly asymptomatic screening of students who live in colleges, because colleges are a bit like HMOs. Clearly there's a risk of spread there. So students will be regularly tested in an innovative way, using pooled samples to ensure that any cases are picked up very quickly and dealt with. Students are being asked to, rather like school bubbles, the students at Cambridge University are being asked to socialise in small groups of 6, so that if there is spread, it should be constrained within a smaller group. So lots of work is going on to communicate with students and staff to make the university processes safe, and to manage outbreaks if and when they occur. So I can assure you that everybody is on the case. But absolutely, it's a good question, because we know that it is in that age group of young people that case positivity is likely to be highest. So we absolutely need to stay very close to this and stay on top of it.
Happy with that, Roger?
Yeah, if I could just come back, it's not so much a question. I'm pleased with what I'm hearing and what's in place. I understand there's lots of online courses being done by the university, Cambridge University, that is, anyway. But I think it's right, and it's students when they're not in the university setting, etc. As we've seen elsewhere in the country, and so communication is obviously key. So I'm pleased that we've got some steps in place here. Thank you. Thank you.
I haven't got anybody else indicating. So but I think all the board are happy with that presentation. Thank you, Liz. It was very comprehensive. So I'm going to move on now to the number 6, which is again you, Liz, which is Peterborough Summit update.
Okay, and I'll give a brief update on this, and then I'll hand over to Adrian Chapman, who also spoke at the summit and was very much part of it. So we organised the Peterborough Summit really for 2 reasons. Firstly, when Peterborough came off the national watch list, we wanted to be absolutely clear that the risk hadn't gone away. In fact, risk levels are rising, as we can see nationally. So we wanted to bring key leaders in Peterborough together and ensure that we absolutely made this point and were working together to continue to contain the risk. But we did want to thank everybody and the vast numbers of people involved in Peterborough's communities for all the work that they'd done to bring us down from having the 6th highest rate of COVID-19 cases in the country at one point back in July to having a stable COVID-19 rate and really coming down those rankings. We wanted to say thank you to people. But then, because we had feedback that communities were getting quite tired, this has been going on for a long time, it just feels like it, you know, you have to keep going with this and everyone would really like to stop. We also wanted to re-energise and get everyone's ideas as to what we wanted to do next. So at the summit, we presented the latest epidemiology, we presented the change in the national rates, the change in Peterborough's ranking, and we presented a sort of flowchart which showed what had happened, what actions we had taken since July when we went on the watch list, and how that had influenced our epidemiology and helped keep those rates stable, just to show people that what communities did really mattered and really made a difference. After that, I handed over to Adrian to present, and he presented on the rapid response work and what had been done in much more detail. And then we had a really good session where we were gathering everybody's ideas, all of which were noted, and the rich information that people could bring, such as information. We had some very good information, just for example, from the Polish community representative, and also some fantastic accounts of what people are doing day to day, going into shops, persuading the local shopkeepers and customers to use masks. Really detailed work going on the ground from our community leaders. I'll hand over to Adrian at this point because he was very much involved in the summit, and I think you've heard enough of my voice for the moment. So over to you, Adrian.
Mr. Chapman.
Thank you, Liz. Thank you, Chairman. I actually don't have a great deal more to add. I think Liz has just given a really positive summary of what was a really positive event. I think we got a lot of constructive commentary from it. It wasn't just about saying thank you, as Liz says. It was also about learning where some of the frustrations are. We've got quite a lot of intelligence that I think will be able to shape our strategy going forwards. I think for me, 2 or 3 important points. First of all, it really did reinforce the strength of the work we've done with the community here in Peterborough, and how we need to make sure that our colleagues across the rest of the county have got similar relationships in place, and many do. Because actually, as Liz has described, the flowchart that we shared showed a direct correlation between community action and a reduction in prevalence of the virus. So the evidence was before us. The other point I'd make is that whilst this was focused on Peterborough for obvious reasons, we do think that the model of a summit of this kind is very replicable into other areas of our county, should that become necessary. So we've tried it now in Peterborough. We will follow up again in Peterborough in a few weeks' time to report back, particularly on the you said we did piece, which is so important. But also, if we did feel we needed to focus in on other areas of our county, we would repeat the same approach, obviously with the district council, relevant district council taking the lead. But we think it's a model that does help shine a light on the issues. So all in all, a really positive event, available on for viewing on the council's YouTube pages, of course. Thank you, Chairman.
Having a fiver a time. I think also we've always had good relationships with the mosque and whatever have you, but I really think it's brought us even closer together, if that's the right terminology, because the way we've all work together is for the benefit of everybody. I've got Roger, you wanted to say something?
Chair, thank you, and please, this is more a matter of housekeeping and security, because this is a public meeting, so if you could just bear with me. We seem to have 2 Ray Bisbees, and I can definitely see one moving, but the other one isn't, and I'm just wondering who that might be, or is it a mistake, or could Democratic Services help?
No, that person's not dead. We did discuss this at the beginning of the meeting. It is somebody through the police that is sitting in on the meeting.
I understand that, Chair, but this is a public meeting and therefore people should know who's actually in it.
Yeah, well, we did know at the beginning.
No, my point is it shouldn't be showing Ray Bisbee as attending.
Okay. I think when we discussed that at the beginning, because they were not a member of this board, but they were listening for training reasons or whatever reasons, that they weren't recorded. But I don't know whether you want to comment on that, Nick.
Well, no, yeah, we checked that at the beginning of the meeting, and to confirm, the bit without the videos on the screen, they don't appear on the public stream.
Thank you, Nick. It's Catherine Kimberley from the Commissioner's Office. I'm just joining the meeting for training purposes today. And you are right, Councillor Holditch, that I could have just watched through the YouTube channel. And perhaps I can do that on another occasion. Thank you.
I'm happy with that, Chair. Sorry, I didn't realise that if you weren't on video, you didn't go out to the public. So that's fine. Thank you for that. Okay.
Well, thank you for that. I've got no other people asking questions, so I'll move on to item 7, which is Christine Birchall on the campaign updates. Christine.
Hello, thank you very much. So I've put together a quick update on the campaign activity since the last meeting that we had in September. So if you remember, I brought some information to you all about a new campaign that we were just planning to launch, which was aimed more at the 18 to 30-year-olds, which was the Council COVID campaign. We had quite a lot of discussion about it and about some of the imagery that we were planning to use and about the celebrity endorsements that we were hoping to get involved in that. This has been running for the last 3 weeks. We've had personal messages from a number of celebrities that we felt would be play very well with his audience and would be very shareable. Certainly the videos that has done the best so far is the actress Miriam Margolyes, who recorded a public service announcement, and that was shared but was seen by 12,000 people in the first 2 days. I'll get an update for you on the success of the others as we're going along. We've also worked, as Liz has said, very extensively with both university communications teams and the student union communication teams at Anglia Ruskin and Cambridge University to use this information also to find find advocates from their own from within the university, and the university boat race team have been extremely supportive and helpful, and they have been making videos and sharing videos and indeed sharing our own videos as well ahead of the students going back. The next iteration of that campaign is the piece that we talked about, which was looking at the symptoms, and that is the bit at which we will start looking at the distribution of thermometers to particular areas. And I think there's been some conversation outside the meeting about the sorts of thermometers that we're looking at, the costs of those, and where we are particularly going to target those. And they will be particularly targeted at venues and places where younger people are likely to go on and attend. We're going to make it very clear this isn't the only way that you can check that you've got COVID-19. It is more of a public awareness thing, and a number of well-respected venues and faith organisations already do this, so we would be picking up the information from those to make sure that any venues or establishments that we engage with to do this have all the right support around them to be able to do it properly. We had, I think when we spoke last time, we were just sending out information to all parents, a guide for schools returning. Our Schools Are Safe campaign, we had lots of posters, we had lots of information going out on social media. We had the guide that went to all parents. We also did quite a lot of media with John Lewis, with Councillor Simon Bywater, with Councillor Lynn Ayres. And by the end of September, schools in Cambridgeshire, I haven't got the Peterborough figures, but schools in Cambridgeshire were reporting 93% attendance against a national average of 87% attendance, which John updated on Friday. So, you know, we're hoping that our Schools Are Safe message is getting through to people, and children are going to school, and that's, you know, really important for us. As Liz mentioned, Peterborough coming out off the watch list has been a big piece of the work that we've been doing. We took a very proactive communications response. We did a lot of pre-briefing of media, because what we didn't want this to be portrayed as a tremendous success. We can take our foot off the pedal. There is nothing more to do here. So it was very much spoken about in terms of, yes, you know, this is really good news. This is our community coming together. It's a community effort, and we are really, really thankful for the community's work and support in doing this. But we are very far from being able to take our foot off the pedal at this stage. So what we need to do is to continue with this work. And there was a lot of media that was going along, which we hopefully you saw with Liz and the manager of Queensgate in the Peterborough Telegraph this week. We had the local leaders summit, and we've got some advertising going up on bus shelters, and that will be up this week, which is particularly looking at issues of self-isolation and when and how people need to do that in a place where people will sort of sit and take notice of that information. And we were doing that in a variety of languages as well. I'll keep caring for Cambridge and Peterborough campaign, which is the campaign which is aimed at a slightly older age group. That continues as well, and that's the one where we're picking up the government messaging and making it more localised. So we were particularly looking at the rule of 6 information when government guidelines changed. And we've also been sharing all the national public health England materials. We've been supporting the rollout of the QR codes in the app, both externally and also towards all of our staff. And then coming up in the next couple of weeks, we've got a lot of communications going out around the set up of the hardship fund, both the national launch, which we are getting materials for, we believe today. I believe that's going to start from something like the 14th of October, but also weaving into that the support that we have always provided in Cambridge and Peterborough through our community hub, through our local hubs, and making sure that people are not put off self-isolating for reasons, for practical reasons, for financial reasons, or not having someone to walk the dog. So there will be an awareness raising campaign across the city, the county and the district areas, and we will be linking in with the government support for that. As I think Liz mentioned before, we are also planning a big piece of work around events. So there is events protocols, there is information on our website, but we're doing a big campaign to actually not just get to people who are the known organisers of events, but general people who will be organising events through the autumn and the run up to Christmas and beyond, to make sure that they understand what sort of measures they need to put in place and the things that they need to do, the ways that they can and can't celebrate. We are planning a radio campaign. Thank you, Councillor Fitzgerald. I think that was your idea initially to say, really, you need to engage with radio. We are pulling that together at the moment. We're costing that out, and we're hoping to get stuff across, produce information that will go across all of our radio stations, as well as a number of things that will go out to very specific organisations. We're also working with lots of local publications in order to highlight the ways that people are celebrating differently this year. So we're trying to give people lots of ideas of different ways to celebrate, as well as pointing them to the rules and regulations which now are in place. We are doing a fair amount of work to support the local contact tracing and making sure that people understand what we're doing there. We spoke this morning on Gold Test and Trace about having this whole series of media events around some of the work that we're doing, the marshals, the contact tracing, the activities that we are doing to support people who get on shared transport. So a whole range of things are being planned there. We're continuing to work with care homes, working with the CCG at the moment on an increase on communications to care homes, and we're renewing our messages in newsletters. And from the 5th of October, we will be supporting the CCG with the flu vaccination campaign. I think I've got some hot off the press information about our celebrity videos. Miriam Margolyes 20,000 plus reach, and we've had more than 100 shares on Facebook. Also the former Love Island contestant, who was also a pop star and a BAFTA winning film producer, Marcel Somerville, he reached 6,000 people. So we're doing quite well. We're getting very good feedback, very good comments from people who are sharing it and who are praising us on our innovative approach to this. And we are making sure that we're getting it into, particularly into the university channels, on Tuesdays and Fridays, which we believe are the prime going out days, because we want to remind people in ways that they will really understand. I think that's it from me. If anybody has any questions, I'd be happy to take them.
Thank you, Christine. That was very comprehensive. And believe it or not, I don't have any questions. So you must have covered everything that, oh, well, I have now. I spoke too soon. So I'll take Val first, ladies first.
Thank you very much. Thank you, Christine. Loads going on as ever, and you know, I sense an awful lot of engagement, and even the suggestion that we might have summits in different parts of the county and things like that, which will really support public engagement with this. I don't know whether I'm worried or not that we don't get any public questions to this board. So that's maybe something for the board to think about, because I think there are other routes to get that. But I'm more interested in, do we have a sense about the public mood around this in terms of their receptiveness or views about compliance and how that's going forward? You know, the general sort of understanding of the public's readiness to accept certain messages or behave in ways that support the situation that we're in now. Are we collecting that or able to, do we get a feel for that in other public meetings or some of the community forums that are happening already around how the public are on this issue at the moment?
Christine?
I think maybe this is something for the community forum to, so maybe Adrian has some views on that. Certainly what we do is we look at the comments that we get on social media all the time, and they tend to comment on very specifically the different bits of campaign that we're working on. And I think there's a fair amount of acceptance about that. I know that at the public summit, we did it specifically because there's an awful lot, I don't think we're getting it directly from our local community, but there's a lot of information about reaching the 6-month wall, if you like, where people have been doing this work for a long time. People are, you know, so we're going to have some people who will never, you know, engage, but a lot of people who do engage really, really well are getting weary. And so we wanted to reinvigorate things around that. I think from the Peterborough Summit, what I heard particularly from some of the community representatives was they had been going out and they had been talking to people on the street, and they said after, you know, 2 or 3 weeks, people were taking it on board. It was becoming more of a social norm, for instance, to wear a mask in places where it hadn't been. So when it becomes less of a new thing I've got to do, but something that everybody does, and that's what we're trying to make it more of a social norm to do the right thing, rather than it being, you know, sort of something that you've just got to keep, you know, if everybody does it, more people will do it. So I don't know if Adrian has got anything more, but say we monitor the actual campaigns and whether or not people think they're hitting the right places, and we're getting good and supportive comments about those.
And thanks through you, Chairman. Just to add, I agree with that, and we've particularly in the north of the county been engaging with a group of community champions through a formal network that we stood up at the start of the pandemic. The feedback we receive, and we do need to keep trying to feed this through into the system so that we can respond, which I think is at the root of your comment, Val. The feedback we get is that the gap between compliance, which is growing, and non-compliance, which is reducing, feels greater than ever. And actually they're, I think, coming now to a place where there's a core of non-compliance which we need to find different and innovative ways to address. And that's why some of the feedback, particularly from community representatives at the summit on Friday, was so valuable, because there were some comments made about certain parts of our community who simply weren't able to comply for very, very valid reasons. But had we not had that engagement, we wouldn't really have known. So I do agree with you, Val. The idea of the local summit is absolutely helpful in shining a light on local nuances and helping to close that gap between compliance and non-compliance. But it does feel generally like things are improving and the public are coming with us.
Thank you.
Roger?
Yeah, thank you, Chair. I think it's a good question from Val, but I would have thought Health Watch would have been in quite a good place to have input into the answer to that too. So maybe you could bring something back next time on that, Val. That would be good. Chair, I just wanted to comment on all the good work that's going on at the moment. It really is fantastic. And Christine's just rolling off so many different things that are happening at the moment. It can only be good. I just wanted to pick up on one thing, which was temperature testing, which I know has been questioned, and you know, there's no definitive evidence as such, and then there is, and then there isn't. I personally, you know, have been on a campaign for more temperature testing, and I just think it's great the situation we find ourselves in now. It's not a definitive test, as we all know. It is part of the weapons in the armory that we can use, and I think it's a real good visual reminder for a lot of people as they're out and about. Not only those actually entering arenas and bigger gatherings, but also those that are just passing and seeing other people having their temperature tested. I just think it's a very, very good reminder for social distancing and where we are with COVID at the moment. So just thank you for everything that's going on at the moment.
Okay, I don't have anybody else wishing to speak, so thank you very much, folks. I believe that concludes the meeting. Your next meeting is the 6th of November at 11 o'clock. Thank you very much.
Thank you.
Good day.